Moving on to the life course dimension of inequalities and exposure to crime, I'll present on some of the research that's been conducted from the perspective of people rather than place. As John has ably demonstrated, improving practice and policy in relation to the reduction of inequalities and exposure to crime requires a good understanding and appreciation of both. I'll start by considering how changing patterns of crime have impacted on victims. Over the last 30 years, since around the early 1990s, there's been a large reduction in crime across the UK, many parts of Europe, and other parts of both the developed and developing world. This slide gives some examples of the extent of the decline in the US in the top left, across various international countries in the top right, in England and Wales at the bottom left, and in Scotland in the bottom right. It's widely agreed that the crime drop was an international phenomenon driven by largely global rather than local factors. To a large extent, change in exposure to crime has been measured in aggregate terms at a national and sometimes subnational or city level, mainly but not exclusively using police recorded crime statistics. But this tells only a partial picture. Firstly, aggregate level spatial analysis tells us nothing about the people behind the numbers, the people who commit the crimes and those at the receiving end as victims. Crime is, after all, experienced by people, not by countries or cities. Secondly, not all crime is reported to or recorded by the police, and so there are gaps in the measures of exposure to crime. And thirdly, the number of crimes recorded by the police does not equate to the number of victims. Police data cannot, for example, demonstrate that a small proportion of people often account for a large share of all crimes. Surveys offer a good alternative to measuring exposure to crime from the perspective of the victim. Since the early 1980s, the UK has been collecting data from social surveys to measure the prevalence and incidence in victimisation. Over the last 40 years, surveys have captured the profile, characteristics, experiences and views of hundreds of thousands of victims of crime. So what have they told us about changing patterns of exposure to crime, and more importantly, inequality in such patterns? Let's start by recapping what we've learned from the victim surveys over the last 40 years. Firstly, the public experience far more crime than the police know about. For example, in the most recent Scottish Crime and Justice Survey covering the year 2018-19, it was estimated that the police had recorded only 34% of a subset of comparable crimes that were measured by the survey. So 2/3 of those particular crimes were never recorded by the police. That's a lot of crime and a lot of victims. Secondly, we know that most crime is trivial. In other words, it doesn't cause any serious damage or excessive costs, although that doesn't mean it's not annoying, inconvenient and a worry for many people. But very few people experience really serious crime. For example, a Scottish Crime and Justice Survey tells us that only 2% of people experienced violence, and 60% of those were minor assaults resulting in no or negligible injury. Thirdly, the survey tells us that crime is not spread evenly, and a small proportion of people experience a disproportionately large amount of crime. For example, the most recent Crime and Justice Survey tells us that 3.5% of adults in the population experienced 55% of all the crime that was measured by the survey. And the survey also tells us that there's inequality in the exposure to crime because it tends to be concentrated in certain groups of people. For example, men are typically at greater risk of being victims than women, young people are at greater risk than older people, people living in poorer communities are at greater risk than those in more affluent areas, and people living in urban places are at greater risk than those living in rural communities. But these surveys can tell us so much more. By combining the strength of the surveys over time rather than just looking at each one individually, we used multiple years of the Scottish victim surveys covering tens of thousands of victims in a quasi-longitudinal way to examine the extent to which the risk of being a victim of crime had changed over time. This allowed us to identify whether the profile of victims had changed and whether there was any change in inequality in the risk of becoming a victim. Analysis showed that from the early 1990s to around 2014-15, there was a large decline in victimisation in Scotland, but this was largely accounted for by a significant fall in motor vehicle crime and other household crimes such as housebreaking and household theft or damage. There was also some decline in robbery and other forms of personal theft. However, there was no measurable decline in violent assault or threat of assault over this time. However, this only tells us about types of crime. It doesn't tell us about people's individual experiences. So by combining information on the likelihood of being a victim, type of victimisation, and number of incidents of victimisation experienced, we were able to identify how exposure to crime had changed for people over time. The green line on this slide shows that from 1993 onwards, there was a large increase in the likelihood that people in Scotland would be a non-victim. In other words, exposure to crime reduced. So who benefited from that? While the blue line at the bottom shows that there was a large decline in what we've called one-off property victims. In other words, those people who might be unlucky enough to have their car stolen, their house broken into, or their property vandalised once in any random year. The purple line shows there was also a modest reduction amongst those we've called multiple mixed victims. Those people who might experience more than one incident of crime, including a mixture of property and personal crime, but rarely more than 2 in any one year. However, there was no change at all in the red line, those we've called frequent personal victims, who would typically experience 3 or more incidents of crime in any one year, and especially violent assaults and threats. So this work tells us that although crime has fallen in Scotland, we've not all benefited equally from the crime drop. The level of exposure has fallen most for people who are already at least risk of being a victim, and hasn't fallen at all for those at most risk of being victims, especially violence. This means a widening equality gap. But for whom? More recent work has examined the characteristics of victims to see whether victimisation is changing for particular groups in society, and if so, if there's any worsening or emerging inequalities in the likelihood of being a victim of crime. Unfortunately, the Scottish Crime and Justice Survey doesn't collect a vast amount of information on the personal characteristics of the population, including variables that are often predictive of victimisation, such as lifestyle, problematic behaviours, engagement with the nighttime economy, mental health, or aspects of vulnerability. However, we are able to take into account some core demographic factors, such as age, sex and ethnicity, and some socio-economic factors such as social class, income and financial stress. Our analysis is preliminary and not yet published, so I can't reveal too much of what we found. However, there's clear evidence that falling crime in Scotland has masked an increase in economic inequality between those who are victims and those who are not. The figure on the left shows that even when we account for a range of other factors that explain someone's likelihood of being exposed to crime victimisation, victim exposure was significantly higher for those living in social rented accommodation. It was higher for those living in Scotland's 15% most deprived communities, and it was higher amongst those who struggle to access a relatively modest amount of money in an emergency. Risk of victimisation is not necessarily higher amongst those on very low incomes, so it may be more related to lack of wealth rather than low earnings. The figure on the right shows that inequality and exposure to crime has increased between those who experience financial hardship and those who don't over the last decade. The top panel shows the victimisation rate for those who struggle to find £100 in an emergency compared to those who didn't over a 10-year period. Importantly, this figure accounts for the effect of lots of other factors on exposure to crime, so the panel shows the additional effect of financial hardship over other things. You can see that the victimisation rate for both groups decreased over time, which is good, but the gap between the two appears to widen. The bottom panel shows the ratio between the two groups and acts as a measure of inequality. It shows that even when accounting for a range of other factors and their effects on exposure to crime, there's been an increase in inequality between those with financial hardship and those that haven't over this period of time. Thus, those who struggle to access even a modest amount of money when in dire need, which may well be those on benefits or those in extreme financial distress, are unfairly exposed to crime, which is likely to impact further on their economic situation. Our analysis is a cautionary note because, as you can see, it's easy for such inequalities to be concealed and therefore neglected in the course of an overwhelmingly positive narrative about falling crime. Change in exposure to crime for victims is only one part of the equation from the point of view of individual level analysis. It's also important to understand change in the offender population, especially for those working in communities of policy and practice. So what do studies of offenders tell us about the impact of the crime drop? Like victims of crime, there's strong evidence that the profile of the offender population has changed in recent years. Doctoral research by Ben Matthews found that the age and sex profile of those who are convicted in Scotland has changed substantially. Examining criminal convictions over a 20-year period, Matthews found that the rate of conviction for 17-year-old men had declined by 63%, while the rate for 30-year-old men had increased by 21%. This distinct shift in the age crime curve for men was also reflected in women, although to a different extent. The rate of conviction for 17-year-old women had declined by only 37%, while the rate for 30-year-old women had increased by 53%. Lack of linked data means it's not currently possible to examine the changing socioeconomic profile of the adult offender population in Scotland. However, such research has been conducted using registered data in Sweden. In addition to finding a similar shift in the age and sex profile of offenders to that in Scotland, Nilsson and colleagues were able to show that reductions in conviction for theft were greater amongst more affluent people, and increases in conviction for violence were primarily located amongst those at the lower end of the income distribution. They argued that this has resulted in an increasing socioeconomic inequality in the risk of conviction, particularly amongst men. A wealth of evidence suggests that the crime drop in Scotland is primarily the result of a reduction in offending amongst young people. Survey data confirms that there's been a dramatic shift in youth offending. For example, comparison of two Scottish longitudinal studies conducted 20 years apart, which included the same 9 questions on offending behaviour, found that in 1998, 70% of children at age 12 had committed at least one of the 9 offences, compared to only 30% in 2018. Examination of administrative records substantiates behavioural change. Since the mid-2000s, there had been an 83% reduction in the number of offence referrals for 8 to 16-year-olds in the children's hearing system, a 77% reduction in the rate of convictions for 16 and 17-year-olds, and a 60% fall in custody rates for 16 to 17-year-olds. The trends demonstrate not only a reduction in the stock of young entrants to the youth justice system, but a subsequent impact on diminishing flow through the system, from arrests to convictions to imprisonment. There is evidence also that the overall reduction in the youth offender population has created a concentration effect, such that poor and vulnerable children are overrepresented in the justice system. For example, the percentage of young offenders made subject to child supervision orders, which is an indicator of risk and vulnerability, increased from 20% in 2003-04 to 70% in 2015-16. So, the existing research tells us that while overall exposure to crime through offending has reduced in recent years, poverty and vulnerability may be ever more important drivers of problematic behaviour in childhood. We set out to examine this hypothesis and see whether poverty and vulnerability in childhood were both predictors of early offending by age 12. To answer this question, we drew on data from the Growing Up in Scotland study, a national birth cohort of around 3,500 children born in 2004-05 and followed up so far to age 12. To capture vulnerability, we used a measure of adverse childhood experiences, or ACEs, which included 4 dimensions: parental maltreatment, household dysfunction, family trauma, and family offending. To measure poverty, we used 2 variables, one measuring household deprivation based on parental income and employment, and the other based on neighbourhood deprivation. The table on the left shows the results of our analysis into what predicts involvement in offending by age 12. Firstly, using a crude measure of the number of ACEs, we found that the children with 3 or more ACEs were around 1.5 times more likely to report offending compared to those with fewer ACEs. So more childhood adversity does predict offending. However, when testing for the effect of the number of ACEs, we find no significant additional effect of either living in persistent household or neighbourhood poverty. This suggests that for this contemporary cohort of 12-year-olds, they're more likely to find offending behaviour amongst those who have experienced multiple forms of adversity than those living in poverty. Taking our analysis one step further, we disaggregated the 4 different components of our ACEs measure to see whether specific elements of adversity in childhood mattered more than others in terms of predicting childhood offending. The table on the right shows that parental maltreatment, which included lack of love and support as well as experience of corporal punishment and smacking, was the strongest indicator and remained significant even when a range of other factors were taken into consideration. When looking at the type of ACEs rather than the number, we found that neighbourhood deprivation did become significant. This suggests that if research focuses on a crude measure of number of ACEs, not only is it less likely to identify what ACEs are more important, but it may obscure the importance of other factors, in this case living in a highly deprived neighbourhood. So at a time when childhood offending is at a historic low, and there's perhaps greater potential to drive it down further through evidence-based policy making and procedural practice, these findings suggest that a trauma-informed approach to reducing reoffending amongst children might be best targeted at those who experience or are at risk of experiencing parental maltreatment, and that focusing on children who live in the most deprived communities of Scotland may pay particular dividends. However, the relative importance of poor general health might also indicate that early interventions might be delivered, or at least tested, through either educational or public health routes in the pre-secondary school years, for example by law enforcement working more directly with primary school teachers, school nurses or health visitors. But what about criminal justice outcomes? To what extent do poverty and ACEs impact on those? Using data from the Edinburgh Study of Youth Transitions in Crime, a city-based birth cohort of around 4,300 young people born in 1986, we examined criminal conviction trajectories for those young people between the age of 13 and 24. We found 5 distinct trajectories. By far the largest, in blue, was those who had had little or no probability of contact with the criminal justice system. The next largest, we call adult onset, had a rising profile of convictions up to age 24. We also found 2 teenage onset trajectories, one of which started falling in the late teens, while the other continued to rise into the early 20s before declining later. And finally, we found a small but significant group of individuals who had a high probability of criminal conviction even by age 13, remembering that the age of criminal responsibility in Scotland at the time of this study was 8, and then a high ongoing likelihood of conviction throughout the teens and into early adulthood. Using data that was collected about these individuals up to age 12, we examined how likely people were to follow each type of trajectory according to 3 main childhood factors. Firstly, whether they grew up in poverty, which was measured using parental occupation, entitlement to free school meals, and living in a deprived neighbourhood. Secondly, the number of adverse childhood experiences that they'd had by age 12. And thirdly, whether they'd had early system contact based on having an offence referral to the children's hearing system, school exclusion, or being looked after in care. We also took account of a range of other factors, including the person's sex and their offending behaviour up to the age of 12, and then their offending patterns during adolescence, which are shown at the bottom of the table here. We found that poverty was a significant positive predictor of criminal conviction, especially amongst the early chronic conviction group. We also found that early system intervention was a significant predictor of criminal conviction, again especially amongst the early chronic group. However, adverse childhood experiences were not a significant predictor of being in any adult criminal conviction group. Not surprisingly, patterns of offending were strong predictors of future criminal conviction, with high-level serious offending in adolescence being of particular importance. However, early offending by age 12 had little additional impact. These results are complex, but they demonstrate 3 important things. Firstly, that while ACEs may be important in influencing offending, offenders who end up in the justice system may be no more likely to have multiple ACEs than those that don't. Secondly, over and above someone's pattern of offending behaviour, poverty is a key driver of criminal conviction, which suggests an inherent inequality amongst those living in poor households and communities who are involved in offending compared to those from more affluent backgrounds. And thirdly, over and above the effects of offending and poverty, those young people who come to the attention of formal systems at an early age and are dealt with for their behaviour, whether through policing, juvenile justice or schools, are at far greater risk of criminal conviction, especially from a young age, which is another indicator of inequality in how the justice system selects, processes and discharges its duty in respect of young people. So what can we conclude from this overview of changing exposure to crime at the individual level? Well, first, our work has highlighted the key role of poverty as a driver of victimisation and of offending and of entry to the criminal justice system. While crime has been going down, it appears that the poorest in our communities have not shared the dividend, and the level of inequality between those who are exposed to crime in one way or another and those who are not has increased. However, poverty is not something the police or other justice agencies can resolve. This requires structural change driven by more equitable social and financial policies. But it is something that justice organisations should have a strong awareness of in terms of its impact on exposure to crime. Secondly, poverty has a complex relationship alongside other aspects of inequality, including children's exposure to different forms of adversity and the extent to which we process young people through formal systems. This means that addressing poverty on its own is unlikely to be an optimal solution. Until we recognise and address the interrelationships between different forms of economic, social and health inequalities, it will be difficult to address the problems they cause. Thirdly, it's clear that those who have the greatest exposure to crime, whether as victims or offenders, experience the greatest inequality. So access to appropriate support organisations and services needs to be widely accessible, and the criminal justice system is not always the appropriate conduit for this. For example, repeat victims should not need to rely on the police to access victim support services, and repeat offenders with complex underlying needs should not need to rely on the justice system to get access to the addictions or mental health services they need, especially to try and deal with the trauma of their past. Finally, there's a vital need for more data sharing between justice and data and other organisations, including health, education and social care. This will enable research that can support better developments in policing and other aspects of operational practice. Insights into issues such as mental health, vulnerability or social deficits amongst those who pose an often significant burden on policing and other services could be achieved through data linkage for research purposes, which is now fairly standard across health services, especially in Scotland. This should be a priority if we're to better understand the lives, circumstances and inequalities that are faced by those who break the law or experience victimisation. The adoption of trauma-informed practices in policing must be underpinned by accurate knowledge about the impact of ACEs in the context of other factors, and officer training must be based on evidence-based strategies that increase awareness and understanding of those that they encounter on a day-to-day basis, especially those that are repeat and multiple service users.